Hello everyone, welcome back to my channel, and those of you who are joining us for the first time, this is Winnie's Inspirations and Testimonies. Here I share my journey with breast cancer, and I also give biblical inspirations. I'm a breast cancer survivor. I was diagnosed with breast cancer stage 3, and I went through treatment and I was healed, and I'm here to share my journey, to share my story. And the purpose is to encourage, to give hope, and to inspire someone who might be going through a similar situation, or who might have someone who's also going through a similar situation. And so, welcome, and let's take this journey together. And if you've not subscribed to my channel, kindly click on that notification, on that subscription button, and also on that notification bell so that you're notified when I post a new video. And also, go ahead and like my videos, watch them, and also let's make this session interactive by leaving your comments at the comment section. And so, just like I promised last week, that beginning this week, I'll be doing breast cancer awareness, considering that the month of October is Breast Cancer Awareness Month, for those who don't know. And the whole month we'll be looking at breast cancer awareness. We'll be discussing things that pertain breast cancer, as I also give insights into my journey concerning when I'm doing my awareness. And so today I just want us to look on what is breast cancer, the myths that people have concerning breast cancer, and early detection of breast cancer. And so, just our first question, what is breast cancer basically? So, some people believe that cancer is a curse. Cancer is not a curse. Breast cancer is a disease, just like any other disease, just like a flu, just like malaria. It's a disease in which cells in the breast grow out of control. So there are our whole body, as you know, our whole body is made out of cells. That's from our biology, that cells are very tiny components of, cells. They go make up tissues. So those very tiny cells in our body, sometimes they grow out of control, maybe due to miscommunication or due to hyperactivity. Whatever reason is, they grow out of control. And when they grow out of control, they end up being malignant cells, which are cancerous. So in talk of malignancy, we are talking about a situation whereby a cell is cancerous. We have malignant cells and we have benign cells. So the benign cells are those cells that are not cancerous, and the malignant cells are those that are cancerous. So sometimes you might find someone with a growth and you're told that this growth is benign. That means that those cells are not cancerous. So when the cells are malignant and they've grown out of control in your body, that's when we say you have cancer. So when your cells in the breast grow out of control and they are malignant, we say that you have breast cancer. And what are some of the myths that people have concerning breast cancer? And these myths, they are personally, I'm going to use my situation except for one of them, but for the two others, they are applicable to me. And just to demystify them, number one, which is not applicable to me, is that cancer do not affect men. I've seen documentaries of men who've had breast cancer. So men out there, if you feel that there's something wrong with your breast, if you feel there's something abnormal with your breast, don't assume, just go and see the doctor. As I said earlier, it's a disease, it can get anyone. It's not selective. As long as you have breasts, even if they are not like defined like women's breasts, men do have breasts, and they can get breast cancer because those cells can grow anywhere in your body. It can even grow. Some people have had tongue cancer. So if you're a man and you feel that there's something wrong with your breast, just have them checked. Second one now that's applicable to me is that if you breastfeed your children, you cannot get cancer. What I know is that when you breastfeed your children, it reduces the risks of you getting cancer. But it doesn't mean that you cannot get cancer because you breastfed your children. Personally, I'm a mother of 4, and I breastfed all my children. The youngest, I breastfed him for 2 years and 3 months, and still I got cancer. So if you're a woman out there, you've breastfed your children and you feel like you have a lump or there's something abnormal with your breast, any of the symptoms that I'm going to share here, kindly don't assume and say that since I breastfeed my children, I cannot get cancer. Risks are reduced, but it doesn't rule out that you cannot get cancer. So have them checked. Myth number 3, applicable to me, that if you don't have an history of breast or ovarian cancer in your family, then you cannot get breast cancer. Remember that there are so many other predisposing factors to cancer. It's not only the historical, the family history alone. We have the hormones, we have the food we eat. There are so many things that you're exposed to that could cause cancer. So it's not only that if you do not have breast cancer in your family, then you cannot get breast cancer. Personally, in my family, there's no one who has ever been diagnosed with breast cancer or ovarian cancer. And I'm here today sharing my journey with breast cancer because I got breast cancer. And so, let's demystify these things. Let's not assume, like for me, I wanted to give myself reasons not to go to hospital. It took me a whole 5 months after realizing that I have a lump, and the lump now had grown until it was very visible. I did not have to touch it to know that I had a lump. That's when I went to hospital. And for me, that was ignorance of the highest order. And I wouldn't want anybody else to go through what I went through, because God saved me that I did not get to stage 4, of which maybe today I would still be battling to cure now the secondary cancer that it would have affected me. So kindly, guys, before it gets worse, before it spreads to other organs in our bodies that may be very sensitive, let's just go to the hospital at a very early age. And that now leads me to early detection of breast cancer. Now, how can breast cancer be detected early? What I usually say that it's very lucky that breasts are organs that are I can say superficial. They are outside our bodies. There are things that you can feel. There are things that you can observe if there's a problem. There are things that you can see the changes if there is anything. So there are 2 ways of having early detection of breast cancer. So number 1, it's breast screening. Now there's a nini called a mammogram. So if you are above 40 years, you are entitled to go for a mammogram once per year. There is an age limit. So if you are not yet 40, then you're not allowed to go for a mammogram. But if you're above 40, you can go for a mammogram. So if you're above 40 and you're listening to me and you've not gone for a mammogram, kindly just make an effort. Just go and have those breast check. It's a painless process. It can be really, it can be a little bit uncomfortable, but it's not painful. And it doesn't take maybe around 20 to 30 minutes, you are done. And you would have saved yourself a lot, because it can capture even the tiniest form of a lump in your breast. Anything that is not normal in your breast, the mammogram can capture it at a very early stage. So if you are here above 40 years, kindly make a point of going to have your breasts your breast screening. Then the second one now that anybody can do, even the young girls who started just growing their breasts, self-examination. I'm not going to demonstrate here how you do self-examination, but I'm going to leave a link on my description box, which you can follow, which will show you how to do the breast self-examination. And it's recommended that you do the self-examination on a monthly basis. And what will you be looking out as you do for this breast examination? So I'm going to share some of the things that you'll be checking when you are doing your breast self-examination. And if you are going to see any of these symptoms, kindly just make an effort, make a point to go and see a doctor. It doesn't harm just to be told that it's not breast cancer. By then, it's very relieving if you go and you're told, oh, thank you. It's not breast cancer, it's just a cyst or a fibroadenoma. But it's worse than just to sit like I did and assume that it's not breast cancer. And yet, that breast cancer is not seated just waiting for you to go to the hospital. It keeps on growing. It keeps on spreading. By the time I was going to the hospital, it had already spread to my lymph nodes. So just be cautious that it doesn't get to a more life-threatening stage. So what you'll be looking out for, number 1, is a lump or a bump. You see, you might have something that, like me personally, I was just applying lotion to my body and I felt like, you see like there's an uneven movement on my breast. And that's when I started now checking on it, observing it, and it kept on growing. But remember that it's not necessarily that if you have a lump or a bump, it could be cancer. It could be a fibroadenoma, it could be a cyst, or it could be a natural breast tissue. Remember when you're breastfeeding, during ovulation, when you're having your monthly cycle, or if you're pregnant, chances are you'll have lumps in your breast. So if there's a lump in your breast, it could be cancer, it could be a fibroadenoma, it could be a cyst, it could be a natural breast tissue. The only person who can tell us what it is a doctor. Number 2, if you have discharge at the nipple. So at our nipples is where we have our milk. And during examinations, once you felt around your breast, you can also press on your nipple to see if there is a discharge. And if you find there is a discharge and you are not breastfeeding and you're not at that stage where your breasts are developing, you remember when you're young, you would press and you see some watery liquid. And if there is no infection or cyst, then chances are that you could be having cancer and you need to have that one checked. Another symptom that is very, very common is a pulled in or an inverted or a sunken in nipple. You realize that your nipple is pulled in. It's like it's pulled in back to the flesh, or it's inverted, or it's sunken. If you find that your nipple is that way, that's another symptom of breast cancer. Symptom number 4 is a dimple on the surface of your breast. Now you remember number 3 was a sunken nipple. Now you could be having a dimple. You see, there are those people when they smile, they form those very beautiful dimples. If you have something like that on your breast, it could be breast cancer. Then another thing is growing or enlarged veins on your breast. So it might not be a lump, but you might find some very large veins on your breast. And chances are that those veins could be painful and swollen. And if you're light skin, you could see them, they're red. But if you're dark skin, you might not see the red part. But if you have such a vein and you've not had weight issues, like, if you add weight, you're going to have stretch marks. It might look like veins on your breast. And you are not breastfeeding. Also, a breastfeeding mom can develop those veins because sometimes their mammary glands are filled with milk. And you're not having blood circulatory issues, please just have that checked. Don't assume. Then changes in the breast shape and size. If you're not in your monthly cycle, you're not pregnant, or you're not breastfeeding, and you realize that you have some changes in the size of your breast or the shape of your breast, just have an appointment with your gynecologist or your breast surgeon if you can get one. Then a sore on your skin. That's on the surface of the breast. Sometimes cancer comes as a sore. I've had cases of people who've had sores and it later turned out to be cancerous. There was no lump, but it just started as a sore and became a wound that doesn't heal. So if you have such a sore on your breast, have it checked. Then last but not least, if your skin is itching and you don't have any, you've not changed your skincare products, you've not left your breast to be, or your skin surface to be dry, and after changing your skincare products, just if you suspect that it could be a skincare product, you still feel that your breasts are itchy, chances are that you could be having breast cancer. Personally, for me, you don't have to have all these symptoms because it depends with the stage that you're in. Because, for example, the early stages, you might not have a discharge at the nipple. So for me, I had 3 symptoms that I observed when I just went to the hospital. One is the lump that was very clear. Number 2, my breasts were very itchy. And then number 3, I had a sunken nipple. So you can, when you're doing your self-examination, you can have a notebook and note how is your breast looking like, what are the shapes. And if you're able to do these monthly, You'll be able to study your breast. You'll be able to know even when you're having your monthly cycles, how do your breasts behave? When you are, what are the shape and the size of your breast? So that if there's any slight change, you'll be able to capture it at a very early stage. So it's highly recommended that you do it at a monthly basis, and know that this you can do at the comfort of your home. So it's not something that really has to take your time. It's around 10 to 15 minutes and you are done, only once in a month. You can imagine how many minutes you have in a month. Just 15 minutes, just to be cautious and to just make sure that everything is okay. Remember that early detection helps to save life. And men, you can get cancer. Guys, see you next time and have a very lovely day. Thank you very much, and may God bless you. And for those who are watching me at night, have a lovely night too. Thank you, and may God bless you.